Human hands are the #1 source of transmitted pathogens, which may cause healthcare-associated infections in healthcare settings. According to the CDC, 1.7 million American patients are infected with HAIs every year, and 99,000 of these patients die as a result. While hand hygiene is the best way to prevent infections from spreading, hand hygiene procedures are only followed 40% of the time on average. Proper hand hygiene is the responsibility of each and every person in a healthcare setting, and it helps protect our patients and our staff from the risks of HAIs. Hand hygiene is important for 3 reasons. First, it helps prevent cross-contamination between the patient zone and areas such as corridors and public spaces. Hospital patients shed microorganisms onto surfaces such as bed rails and furniture, where they can easily be picked up and spread to other areas. These pathogens can survive on environmental surfaces for extended periods of time, making hand hygiene critical to prevent transmission. Second, proper hand hygiene also helps prevent infections in compromised areas of a patient's body, such as mucous membranes, open wounds, and insertion sites for invasive devices such as IVs and urinary catheters. Hand hygiene can help ensure germs on your hands don't colonize in these vulnerable areas. Third, hand hygiene also helps prevent the transmission of pathogens to healthcare workers like you. Learning when and how to properly perform hand hygiene can help minimize these risks. According to the World Health Organization and the Centers for Disease Control, it's critical to perform hand hygiene at the correct moments in the patient care process. To prevent cross-transmission from the environment to a patient or from one patient to another, hand hygiene must be performed immediately before touching a patient, before a clean aseptic procedure, after body fluid exposure or risk, after touching the patient and before touching objects outside the patient zone, and after touching patient surroundings, such as monitors or bedside tables, even if there is no direct contact with the patient. And of course, hands should always be washed before and after eating and after using the bathroom. There are 2 recognized techniques for performing hand hygiene: using soap and water and using an alcohol-based hand sanitizer. The use of hand sanitizers is preferred in most clinical situations, as they are quick and effective, ready to use at the point of care, and do not require water. But in these situations, you should wash with soap and water when hands are visibly soiled or dirty, when hands show visible contamination with blood, body fluids, or proteinaceous material, when hands have been exposed to spore-forming organisms such as Clostridium difficile, and after using the bathroom. To be effective, hand hygiene must be performed correctly. When using an alcohol-based hand sanitizer, apply product to the palm of one hand. With a rubbing motion, spread the hand sanitizer evenly, covering all surfaces of both hands, especially fingertips, nails, and in between your fingers. Continue rubbing your hands together until the product is completely dry. When washing with soap and water, wet your hands under a stream of warm water. Apply 1 pump of soap and vigorously rub hands together for at least 15 to 20 seconds. Pay special attention to thumbs, backs of your hands, and in between your fingers. Use the palms of your hands to scrub your fingertips and under your fingernails. Rinse your hands under warm running water. Gently pat skin dry with a disposable paper towel. When hands are dry, turn off the faucet using a paper towel. Hospital-approved lotion can be used when you are done washing your hands to keep skin moisturized and protected. Wash your hands for at least 15 to 20 seconds, not including drying time. The use of gloves is another important part of infection prevention. Remember that wearing gloves does not replace the need for hand hygiene. In fact, hand hygiene should be performed every time you remove your gloves. Using a hand lotion after performing hand hygiene can help prevent dryness and irritation by repairing your skin's protective barrier function. Only use lotions approved for hospital use. To prevent skin irritation, use hospital-approved lotions frequently during work shifts, and follow these tips when washing your hands. Always wet your hands before applying soap. Use warm water instead of hot, and dry hands completely before putting on gloves. Jewelry such as rings or bracelets should not be worn during patient care, since it is difficult to perform proper hand hygiene and they may harbor microorganisms. Fingernails should be kept short, no longer than a 1/4 inch in length, as long fingernails are associated with outbreaks of resistant pathogens. Be sure to review and comply with your facility's policies. Good hand hygiene should be practiced and mastered by each and every member of your healthcare team. Making it a habit is one of the most important ways to protect your health and the health of your patients. Protect every touch, every time, and show you care by washing your hands.
Okay, how many seconds?
15 to 20 at
20
least.
seconds. What type of lotion can you use?
Hospital approved.
Hospital approved, okay? Now, when you first go to clinic, it's not gonna be unusual for y'all to have chapped hands, okay? It's gonna happen 9 times out of 10. It's gonna happen. Okay, so you can go like the HEB or something if your hands are really dry and cracked looking, because you wash your hands so many times. You wash them after every patient, you wash them after touching every bed, machines, everything. So it's gonna get dry. You can go to HEB and buy those white gloves and cover your hands in Vaseline and sleep with the gloves on your hands. That, for me, was the easiest thing for me to do. Okay, do y'all need for me to demonstrate it individually, or do you think y'all can guide each other? You have your form, and I want 2 people at a time to go to the sink, and y'all guide each other through this, okay? Bracelets, let's talk about rings and bracelets. Number 1, if you wear rings, bacteria can get underneath it. And even though you wash your hands, if the ring is tight, you're gonna take those microbes home to your family, okay? Now, I know Pandora bracelets are real popular. Please don't wear them to work, because every charm will develop and you'll carry microbes home to your babies, okay, or your husbands, or your elderly grandparents. So be very minimal about what you wear into the clinical setting, okay? I've known so many people that take off their rings to wash their hands, and they forget to put it back on, and they run back in there and it's already gone, okay? What are you gonna do? It's just gone. It's already gone. And even if someone stole it, they're not going to admit to it. You know, so. Huh?
That's why you have those bands, like people who are like they're married. and stuff.
Yeah,
You
they
those
have those
bands.
silicone bands. My
Yeah.
son and his wife wear those a lot. So, but you still have to take those off because of the microbes that can get underneath it. So if you have nail polish, make sure it's not chipped, because microbes can attach themselves onto the chipped nail polish. Okay? Of course, artificial nails are completely against policy.
I thought nail polish wasn't allowed.
Clear.
Clear.
Mhm. Clear nail polish is allowed. Now, that's D&D, but when you go to clinic, you're gonna see technologists have those super long nails, and they're red or green and got diamonds on them and stuff like that. don't see what you see. Don't do as you see. Okay? Okay. Once you're out in the field, if you want to take the risk of being written up, by all means, do anything you want to do. But as long as you're here in the school, there are no artificial nails and there are no nail colors. Okay? Because we teach you DMV rules. DMV is our accrediting body. Another thing, it's my pet peeve, is chewing gum. Okay? It's a $200 fine if you're caught chewing gum while you're taking care of patients. DMV, not Harris Health, DMV. Okay? So I want y'all to split up. I want 2 people from this table. I want 2 people from this table. This table will go to the X-ray lab, and this table will go to the break room. Okay? Take your papers, because you've got to tell your partner what they have to do next. Okay, let's get going.
It's 2 at a time. Well, it's 2 at a time, I think. And then they come back and then we go.
Yeah.
Or like this. I usually do. Okay, don't make me assign you. 2 people get up.
Oh, yeah, 2. Just the.
They're not going to join.